Malaysia's lockdown has been extended for another 2 weeks until the 14th of April. The decision comes after a number of COVID-19 cases more than doubled over the past week to almost 1,800 with 19 deaths. Prime Minister Muhyiddin Yassin has warned the situation will get worse before it gets better. Melissa Go with more.
It's an unusual time we are living in. Prime Minister Muhyiddin, in the nationally televised address on Wednesday, said he understood how the people's lives have changed in the blink of an eye. The COVID-19 pandemic has wreaked havoc not just in Malaysia but across the world. Although he's satisfied with the level of compliance following the imposition of movement restriction order on March 18th, Malaysia continued to record 3-digit increase in new cases daily the past week. More than 60% of almost 1,800 cases reported are linked to Tabligh religious gathering outside of Kuala Lumpur in late February. With more than 1,000 attendees tested positive, there are already reports of fourth-generation infections.
Please stay calm and don't panic. Now, even though we have extended the movement control order, you don't have to unnecessarily stock up on food because the supply is sufficient. And I assure you that food is enough for everybody. I know you feel burdened, but I don't have choice. I have to extend the movement control order for your own safety.
Mr. Muhyiddin said he needs Malaysians to be mentally and physically prepared for what to come. The situation is likely to get worse before it gets better. But he needs the people to continue to stay at home for next 3 weeks till April 14th in order to stand a chance, he said, to break the chain of transmission. Otherwise, the public healthcare system, he said, will be overwhelmed. Some 50,000 strong police and army personnel are manning roadblocks to deter non-essential travel. Drones are deployed to 12 hotspots across the country to monitor crowds and capture images to identify those defying order. These drones can also make public announcement in various languages to curb the virus spread.
Rakyat bukan musuh kita, kan? Cuma kita nak memantau, kan? Musuh kita sebenar ni adalah coronavirus tu. Cerita kalau seorang ada kena kat sini pun dia boleh infect semua orang, kan? There will be one person, kan, who will jeopardize this whole thing, kan? And then it will infect the whole society. These are the things that yang saya rasa kita harus pantau, kan, dengan sekeras-kerasnya.
But fighting COVID-19 requires more than just mandating social distancing, deploying the army and the police, or closing borders. It will take a whole village where each and every one of us will have a role to play to support the frontliners, the doctors, nurses and the healthcare workers.
Nurses yang telah bersara, mungkin mereka ada pengalaman, pakar-pakar kita yang dah bersara ataupun dah berhenti, mereka ada pengalaman, mereka boleh bantu kita lah. Kita dalam proses untuk meningkatkan rekrutmen dan target kita adalah untuk mencapai 2,000 staf warga untuk membantu warga Kementerian Kesihatan.
Currently, 1/3 of hospital beds allocated for COVID-19 patients have been occupied. The government, he said, can convert more places into quarantine centers to isolate and treat patients. Malaysia is also reaching out to China to source for ventilators and test kits. It's conducting mass testing for more than 16,000 next week and in need of 500 ventilators. Prime Minister Muhyiddin will be announcing more measures to help the people this Friday. Melissa Go, CNA, Kuala Lumpur.